Hello, this is a video for my healthcare professional um, presentation video. I chose Christopher Crowhurst as a seasoned registered nurse providing care in Northern California. After years of nursing for almost every unit possible in the Orville Hospital, which is in Orville, California, Chris recently accepted a leadership position as the director of nursing at the Orville Post-Acute long-term care facility, which is part of the hospital. I chose Christopher for several reasons, but simply put, first reason, he has been in the medical field for a very respectable amount of time. I think it's 28 years, 29 years. Uh, so when I was thinking about who to do, I realized that he has witnessed a lot of um, huge changes in healthcare firsthand, rather than me. I've read a lot about changes in healthcare through all my courses. He's actually seen those changes happen right in front of him and how they affected his day-to-day work and the patient care with the changes. Secondly, his journey to becoming an RN, which is registered nurse, of course, is very motivational to me specifically because he started out in the same position as I am currently in as a CNA, a certified nursing assistant. He describes how he put in all of the grunt work and the dirty work in order to gain every bit of experience from like the bottom up, all while persevering through nursing school. Being a CNA paid for nursing school, basically. Lastly, Mr. Crowhurst is actually my dad. Um, so that's my maiden name is Crowhurst. I grew up believing he was a superhero, basically. He often did things that seemed out of this world to me. A really good example was one time our family was attending a local football game. It was actually my first game back in California. While I was playing with friends in a soccer field right next to the football field, all of us friends, we were like playing tag. I think we were like 8 or something. We all heard a loud bang. And quickly we learned that the bang was a gunshot, and a boy in high school, like high school age, I believe, was shot. So the school putting on the game and everything rallied the crowd basically all together and everybody around for safety. And when I got to where my mom was and my sisters were, there was no sight of my dad. I couldn't find him, which had me terrified. Um, and I was losing my mind the entire time we were held there until we got the okay, basically, and the situation had diffused. Uh, Finally, after we were able to walk around and knew we were safe, my dad reappeared and he explained how he was the first medical professional, and I think the only medical professional on site for a good 10 to 15 minutes. Um, and at that time, like I said, I was very young, and which meant when I saw the sight of blood on my dad's shirt, I lost my mind. And I asked him, of course, like, what was that from? What happened? And he explained to me how he didn't have anything else to stop bleeding. So my dad, I don't know where he learned this trick. He had to put his finger in the gunshot hole to stop the boy's bleeding or slow it down at least so it didn't stop it. Um, and that just was crazy to me. I always thought my dad was a hero for that. Um, so another moment of like his hero like behavior was actually again in the spring of 2016 when he noticed something was actually wrong with me and my behavior. I guess I was acting erratic. I was constantly angry, very angry, which just wasn't normal me. And he knew that because he dropped me off at school at college 2 years prior to that, and he knew that when he dropped me off, I was the normal Christina, happy and everything. Um, so he just took mental notes of my behavior and all the little things that didn't seem very right or normal. For instance, I had migraines that wouldn't go away with any regular remedies or anything over the counter medication wise. Um, and it got to basically a fever pitch or a breaking point when I had came really close to taking like ending my life because the pain was so bad. Um, and that made my dad desperate for answers. So I guess at work he was voicing his um, concerns about this with colleagues, and a really good friend of his actually is a neurologist at the Orville Hospital, and he heard all of my dad's explanations of symptoms and what was going on, and basically his friend just said, "Hey, I think you need to get an MRI done. It sounds really consistent with a brain tumor." So, and I thank God because he said that. My dad got talked me into getting an MRI, and it was a brain tumor, and it was a low grade tumor. So it had been so small, it hasn't progressed so much that basically they were able to operate, which is a really good thing, and return me back to a somewhat normal life. So that was awesome. So when we did our interview or my interview questions that I prepared, I decided to use. They were basically focused on breaking down his career path and his day-to-day work routines, which allowed me to gain wisdom and the guidance for my own growth as a healthcare professional. Um, so one of my, I mean, this is just examples of questions. I asked him, how do you establish priorities in setting an agenda for your shift time on the floor? That's a huge thing for me, just having priorities. Um, his answer, which was in quotes, it says easy with exclamation marks. Who might die first? And then there's end quote. It sounds kind of macabre, but he explained he evaluates the most urgent task to the least urgent task that he's required to do during that shift, and that's how he progresses. And he just starts knocking them off. Um, and one of his most used and favorite sayings pertaining to that is "Let's walk and talk." He basically he's explaining that if there's a need that's pressing, we can usually figure it out while addressing another need. A lot of them are interlocked. Another one is tell me specifically what have you done to show you are a team player. He explained jumping in and helping out, um, knowing how to do any task he asks anyone else to do. So he makes sure that he knows how to do that if because he's asking somebody he wants to be able to help them if they need help. And then finally he says to teach others, and which brought another quote from him. It's see one, do one, teach one. So yeah, basically it's a progression of learning and being able to teach people. So you observe, yeah, learn, do. Um so by conducting this interview, I learned that we all share common struggles, that many complications and hardships we perceive as we think they're unique to ourselves, um, but they're actually common to a lot of our colleagues. Um, I know that, I mean, I know now through all of this that seeking advice from well seasoned professionals in my career field um, can allow me to see that I'm not different or unsuccessful because of the struggles that I'm going through with this. Um, but rather, I'm just going through the process of becoming an individual that I want to become. Um, I also learned that, let's see, oh, the learning and education never ends for an effective healthcare professional. Um, my dad explained how he has continually received and sought out education throughout his full 28 years as an RN. Um, they have to do continued education. I think it's 30 hours for 2 years, and he's currently at 100 and something hours for his continued education units. So he likes learning. So to conclude this long video, I'm sorry, I basically let you all know what made me decide to interview Christopher Crowhurst and how his professional healthcare career has influenced me. I also briefly discussed a few interview questions, no, not all of them, which I wish I could. Um, I had asked him during our discussion, and the answers he built for me. I mean, he put a lot of answers in there. Um, I would like to close with a quote, though, by Maya Angelou. I think it is. The quotes, as a nurse, we have the opportunity to heal the mind, soul, heart, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel. It's totally true. And that's it. Thank you.